Hello, this is Don Shum, Vice President of Audiology at Oticon, and I want to welcome you to this edition of the podcast program. In this edition, we are going to talk about the nature of what our patients are actually facing when they come to you and report having hearing difficulties. I want to dig into the nature of what they experience and talk more about how they talk about the difficulties that they're having. The more you are aligned with the experiences that your patients are having, the more effective your counseling and treatment decisions will be. In a previous podcast, I talked about the effect of sensorineural hearing loss and how it creates a distorted and incomplete neural code that gets sent up to the cognitive system. When that incomplete or distorted code is then received by the cognitive system has to work that much harder to fill in the blanks, to try to decipher what the intent of the talker was, to try to put the message together. And if the information coming from the periphery is more and more distorted or less and less complete, then the cognitive system has to work that much harder to try to piece together that message. Previously, I also talked about the effect of aging on the cognitive system. And the basic effect of aging is that the cognitive system becomes less and less efficient as adults get older. Of course, there's a tremendous amount of variability from patient to patient on how that is going to manifest itself. But in general, there is a decline in how efficient the system is, how quickly the cognitive system can access different parts of the cortex in order to try to make sense of a message. The sum total is that what the patient experiences is not so much a loss of sound. Patients don't come in and talk about the soft, high-frequency sounds that they don't hear. Sure, occasionally they can identify sounds that they don't hear well, but the more likely way that a patient talks about their hearing loss is to talk about how when they're at a party or when they're in a restaurant or when they have their whole family around at a dinner, that they tend to be overwhelmed by sound, that they tend to feel like they hear too much sound, that everyone's talking at once, that they can't keep things straight. They may talk about the wall of sound or being overwhelmed by sound. And the reality, of course, is that they're not hearing more sound than the person with normal hearing is in that situation. The reality is that they have lost the ability to organize that sound. So in general, we believe that the biggest challenge that the patients face is the loss of the ability to organize sound. And that is determined by two factors. One is the quality of that signal coming up from the peripheral auditory system. How intact is it? How much information is properly conveyed in that neural code? And the second factor is how efficient is the cognitive system at working to fill in the gaps, to use that incomplete code to try to put together a total message. And the combined effects of sensorineural hearing loss with any sort of normal age-related changes in how efficient the cognitive system is leaves the patient with the perception that there's too much sound to have to deal with, and they can't organize that sound picture. They can't decide how many different sources of sound there are. They can't tell where those sounds are coming from. They can't follow one speaker and suppress the other sounds in the environment. And that is probably the most frustrating part of having a hearing loss in an older adult, is that ability to just be around a lot of different sound and not really have a clear picture of the part of the message that they really want to pay attention to. Why is this way of thinking so important? Well, I think there's three reasons. The first reason is that it helps to align the discussions and counseling that the hearing care professional has with the patient. The more in touch you are with the patient's actual experience, of course, the more that you can communicate things in terms that are going to make sense to them. Second of all, this way of thinking really affects the way we at Oticon think about creating solutions. When we think about technologies like Open Sound Navigator and Spatial Sound and SpeechGuard, those are all technologies designed to try to preserve the maximum amount of information that we feed into the cognitive system. We know that system is going to be corrupted to some degree by the effects of the hearing loss. But our goal is, even after that disruption occurs in the peripheral auditory system, that the patient is still left with something usable as a signal. And finally, if we get the technology right, it allows the patient to make maximum use of the residual capabilities that they have. The remaining capabilities of the auditory system and the cognitive system can be used to the greatest degree possible to allow the patient to get the most out of their hearing as they possibly can. We can't make hearing normal again, but what we can do is try to allow the patient to get as much out of the system as they possibly can. And we believe understanding how the system works and then creating technologies that really reflect the cognitive nature of listening are the best things that we can do to really help your patients end up at the very best place possible. As always, if you have any questions or comments, please feel free to contact me. My email is d.shum@oticon.com. Thank you for your time.